Hey, I'm John, and this is my 2-week update regarding the surgery that I had for my medial meniscus posterior root tear. So it's been just over 2 weeks since my surgery. I'm doing really well overall. Mentally, feel pretty good. I think I mentioned that in my last video. Was having a lot of anxiety kind of leading up to the surgery, just if it was the right decision or not. Still don't really know if it was the right decision or not, but at least I don't have the anxiety about it. So that's good. Physically, not too much pain. I would say it's very low right now. We're 2 weeks in now. I would say I kind of think about it as different phases. So the first phase was the first few days. Everything was very tender, first 3 to 5 days. A lot of swelling, very tender, really hurt to be upright on the crutches, just the swelling, the pressure, kind of all the blood rushing down, when I would be upright on the crutches. So I was trying to be, laying or having my, legs raised as much as possible. After about day 5 or so, I just felt more mobile, was able to kind of get up the stairs, sleep in my own bed. That was certainly really helpful. Still had the swelling when upright on the crutches until probably about day, 11, something like that. It's been a few days now. Today's day 14. It's been a few days that I've felt a little better about that. I'm also getting better on the crutches and just like knowing how to move around and stuff. So that's good. Just feel a little bit more mobile, a little more confident, getting around. As far as the mobility of my knee itself, so my protocol for PT was the first 2 weeks, really keep the leg, straight most of the time, and then just passive range of motion to 60 degrees. My first PT session, I was able to get to about 55 degrees with a passive range of motion. So that's not using your actual leg muscles, just kind of, using your hands to pull your knee to that degree. Had my third PT session just earlier today. And so now that we're past the 2-week mark, I'm allowed to go to 90 degrees. And so I was able to get to 78 degrees. What's preventing me is basically the swelling in the knee, and it prevents me both from bending it too much past that 78 degrees, I guess, today, and then also from like fully straightening it. It seems to be getting better, seems to be going down, but basically I can get my leg mostly straight. It's just when I get it fully straight, I can't really fully flex that quad. The swelling in my knee is all kind of just above the kneecap. And so it kind of gets in the way of that, like the lower part of the quad from really flexing fully. And so it's kind of like a weak, flex there. If I bend my knee a little bit, I can flex my quad, but if I have it straight, I can't really. So those are kind of my challenges right now. Just getting my leg, fully straight, and then working on that bend to try and get up to about that 90 degree mark. I'm not going to push that. I'm going to kind of, give that a few days and not worry too much about that. But yeah, just overall feeling pretty good, I guess. The pain's not too bad. I've only took a Percocet each night for the first 3 nights. Haven't taken anything since. Took a couple Tylenols, I think, for a couple of those nights. Really don't need anything right now in terms of pain meds or anything like that. Probably need to be icing a little bit more than I am. I've only been doing a few times a day lately. Probably should do a little bit more of that, because that is real good. I feel real good when I do that. I think certainly helps get the swelling down. But all in all, just feeling, pretty good about it. 2 weeks down, so we're a third of the way there. So that's good. It's been busy. Today's the day after Christmas. So certainly yesterday was busy, and, the days leading up to that, I think that's been good for me. There's just not a lot of time to sit around and, mope or complain or anything. There's just a lot going on, ordering stuff online, presents and things like that. Got some work stuff that I'm kind of doing as well, and then just kind of managing everything. So yeah, I would say stairs right now. I'll give a little update on that. I'm regularly going up and down the stairs, couple few times a day. I'm still not quite comfortable I feel like it's a little bit of a risk to go up and down on the crutches. I feel like there's a 95% chance I'd be okay, but there's a 5% chance that I might wipe out. And it's just not really worth the risk. So what I do is basically when I have two railings that I can hold on to on either side, then I'll put my arms on those railings and I'll hop up on one foot or hop down. But part of our stairs only has a railing on the one side. And so for that, I turn around, sit down on my butt and scooch up, one stair at a time for those handful of stairs, or, scooch down one stair at a time. Takes a little while. It's a little embarrassing, but it's safe and it gets the job done. So I guess that's good. So yeah, I'm not sure that there's much more to update about there. Let's see, my hands are getting a little bit sore, just not from this pair of crutches, but there's another pair of crutches I have that is better on like the armpits, but puts more weight on your hands, and the grip is very, very firm, is not cushioned. And so get a little bit of kind of bruising like in my like palms and stuff, just from holding, myself up on the crutches, but it's not a big deal. Overall, just, like I said, I'm feeling pretty mobile, all things considered. I guess I'm excited about the fact that I've had some signs of progress, each few days. That first 3-4 days, pretty difficult, and then you're a little less tender, and then after a few more days, I was sleeping in my bed, and then, after a few more days, okay, then I can actually be upright a little more on the crutches, and, a few more days, and that's where I'm at now. Now I'm allowed to bend to 90 degrees, so I hope to see some, more signs of progress here over the next few weeks. Not quite sure what those are going to be. Maybe they're just me getting better, on crutches and stuff, figuring out how to do stuff or what. But anyhow, like I said, overall, both mentally and physically, probably a little better than I was expecting. That said, I was prepared for it to be a little bit rough. So feel good about that. So anyhow, hope that's a helpful update. All right, thanks. See ya.